The West Nile virus has claimed a life in Travis County. The Health and Human Services Department confirms it's the first death due to the virus this year.
This death was reported yesterday, and doctors are saying it is the first in Travis County in nearly a decade. KXAN's Angie Bevan joins us live in the studio with more on why health officials say the risk is high.
Well, doctors tell us the confirmed death is one of 4 cases they're working here in Travis County. Another case in which the patient was hospitalized is now closed, and doctors say that person is recovering. Health officials are saying one reason behind the threat of virus-carrying mosquitoes is the ideal conditions. Doctors with the Austin-Travis County Health and Human Services Department say West Nile virus is high on their radar. That's because they're seeing more cases than usual. And Monday, the first death due to the virus was confirmed in the county.
The patient had been ill over the last week and hospitalized and then passed away yesterday.
Health and Human Services are also investigating 3 other cases of West Nile virus in Travis County. Dr. Huang says the mild winter combined with recent rains created ideal breeding conditions for mosquitoes.
We monitor for mosquitoes for having West Nile virus. The last couple of years we've had none. This year we've had like over 50 pools of mosquitoes that have had reported positive for West Nile virus.
Before Monday's death, the most recent in Travis County was in 2003. Dr. Wong says the patient fit into the high-risk category for the virus, being over 50 years of age. He also says the person's illness developed into the most serious form of the virus, a neuroinvasive disease, which is an infection of or around the brain.
It's about maybe 1 in 150 cases of West Nile virus develop that severe condition.
So what do the majority of West Nile cases look like? The doctor says 80% of people who contract the virus will have no symptoms, and 20% get a mild illness, something like fever, headache, body aches, swollen lymph nodes, or a rash. Doctors say if you come down with similar symptoms, to seek help. The Austin-Travis County Health Department is tracking not only human cases of West Nile virus, but also cases in mosquitoes themselves. Take a look at this map. It shows where West Nile carrying mosquitoes have been found in Travis County. It's broken down by zip code. The blue part of the map shows the county, and the green shows Austin city limits. The areas in red and yellow show where the health department has found mosquitoes carrying the West Nile virus. Now you can see the zone ranges from the Williamson County line all the way to South Austin. You can get a closer look at that map right now at KXAN.com. We have a link on our front page. In the studio, Angie Bevan, KXAN News.
These West Nile cases are a growing concern in many parts of Texas right now. We checked with the Texas Department of Health and found on average the state has 49 human West Nile cases by this time of the year. Last year, Texas only had 3 cases, but this year there are 111 reported cases statewide, and 6 people have died so far. 80% of them are in Dallas, Collin, Tarrant, and Denton counties.
The West Nile virus likely is here to stay, and that means you need to take some steps to protect yourself. Health experts recommend the 4 Ds. Dusk and dawn, that's when the mosquitoes likely are to carry the infection are most active, and you should stay indoors. Dress, wear pants and long sleeves when you go outside. DEET, use insect repellent that contains the DEET compound. That information is on the label. And drain, get rid of all the standing water around your home, and that could be breeding ground for the mosquitoes. And